Hi, my name is Carly, and for my thesis, I chose to evaluate and analyze emergency room discharge instructions. I chose this because I currently work for two different ERs and have been in the emergency room for the last 5 years. And one of the biggest issues, in my opinion, is emergency room revisits. So, a patient coming in and being seen for abdominal pain or something like that, and then coming in the next day, or 3 days later, or a week later. And it's the same symptoms, it's the same thing. And this is a huge cost, especially if they don't have insurance or something like that. So I wanted to look at why this is happening. And so I chose to go down that route. And what I found is that most emergency room discharge instructions are written at a 10th grade reading level or higher. And the average American U.S. citizen reads at an 8th grade reading level. And it's just not appropriate for these emergency room discharge instructions because these are supposed to be a tool that the patient can go home with and be a self-advocate for their own care and continue on this continuity of care. I'll show you what an emergency room discharge looks like. I have whited out anything that has to do with a patient. That could be a patient identifier, and even the label or for the hospital that I work at. So this is kind of the first page, an after visit summary, also known as an AVS. And it just gives a summary of what has happened, your set of vitals. Sorry, I know it's probably mirrored. But then who you should follow up with, other important information. If your medication had changed, it would be here. This is the second page. This just kind of talks about medicine, like antibiotics and test results possibly. And then this would be the medication list on the third page, which obviously differs for each patient. And then this is the real start of discharge instructions. And then, so just depending on the doctor and kind of what they want to do, will change for each set of instructions. My thesis for this paper was that I will study and evaluate healthcare documents in the form of ER discharge instructions to provide results and information for health systems seeking to improve or modify their AVS by scoring them based on the PMAT. So the PMAT is an analyzing assessment tool. It was created by the Agency of Healthcare and Research. It stands for Patient Education Materials Assessment Tool for Printable Materials. That's the PMAT-P. So that was my quantitative data. So because I chose to do a mixed methods approach, so those that was my quantitative aspect. And then for my qualitative, I did a thematic analysis. My results for the quantitative data based on the PMAT-P, the average score for understandability based on 3 sets of discharge instructions was 78.7%. The layout and visual aids was 53.3%, and the actionability was 73.3%. So they scored higher than average, obviously not perfect. And then for my thematic analysis, I kind of went through and judged them based on my experience and my knowledge from the emergency room. And my 3 themes were when to come back to the emergency room, like fever, shortness of breath, chest pain, anything like that that could be indicative of something very serious health-wise going on. My second was your medication compliance. A lot of patients are often prescribed antibiotics and they may not go and pick them up. Well, you're not going to feel better if you don't start your antibiotic. It's important. And a lot of the times that one of the hospitals I work at, Myers will refill your antibiotic prescription for free. Antibiotics are super important for anyone that needs them, and it helps fight that infection. So that's super important because you don't ever want to become septic. Um, and then my third was follow up. So oftentimes, like, especially for like orthopedics, is probably one of the most recommended follow ups in the emergency room, whether it be a broken wrist, a fractured ankle, and that's listed on your discharge instructions, but it's super important that the patient realize that they need to follow up with that doctor if they want to feel better. I analyzed scholarly articles, as many of you did. Sorry, just and what I found is that a lot of really good research has been done so far, but there definitely is still more to do. I'll just read a little bit of one of the scholarly articles that I found. So during my thematic analysis of the discharge instructions, it pointed out that during the event of the nurse giving the patient the instructions, how vital it was to effectively communicate the three themes that I mentioned, which wasn't the case in one of Zavla and Schaffer, as many of what the participants in their study found and complained about was that those three things weren't clearly communicated during the discharge process. And it is so important that the nurse touch on those three things, which is why I chose them as my themes, which I also consulted my coworkers, and they agreed that those are the most three important themes that they should at least verbally communicate, which is on the discharge instructions, so it is written for them, but it's really hard in that situation. You're in the emergency room, you have so many thoughts, so many things going on. So that's why it's important that these discharge instructions are wrote at an appropriate health literacy level so that when the patient does go home, they are able to look back at them as a reference and use them to better their health. Obviously, you can't make everyone comply, and that is always going to be an issue. It's not anything that any nurse can fix, and or any study or research can fix. But I found that it was a very rewarding study. I feel like a lot still needs to be done. To improve my study, I really would have liked to do personal interviews, but I really just wanted to dig in deep and really analyze the instructions and decide if they were written at an appropriate health literacy level, which I often found they were not. There were often words used. One of the symptoms or diagnosis that I chose was a DVT, also known as a deep vein thrombosis, or also known as a blood clot. Many people think this is a life-threatening emergency, and it is if it's in your lung and has a possibility of going to your brain. It definitely is. But like a lot of time in the leg, you can be sent home with a blood thinner. But I found in the patient discharge instructions, they use words like PTINR, anticoagulant, which is another word for blood thinner, which I definitely delved into my paper. But honestly, what I found is that a lot still needs to be done in working to modify and make the discharge instructions better for the patient to go home and to be their own advocate. So I hope everyone had a great semester. That's kind of my summary of my paper. Thank you.